Assalamu alaikum. Today's article is titled Elective Full Bulbotomy in Mature Permanent Teeth Diagnosed with Symptomatic Irreversible Bulbitis. It's a 2-year retrospective study done by a Spanish group and published in Clinical Oral Investigation in 2024. Published studies on the outcome of full bulbotomy usually refer to cases in which bulbotomy was performed after the occurrence of bulb exposure during carious tissue removal. And there have been only a few studies evaluating the outcome of full bulbotomy performed electively to treat irreversible bulbitis. So the aim of this study was to investigate the outcome of elective full bulbotomy using calcium silicate-based cement after 2 years in symptomatic mature permanent teeth with carious lesion diagnosed as irreversible bulbitis, and to analyze the capacity of Walters et al. 2017 classification to predict the likelihood of treatment failure. The study was carried out with the medical records of patients treated from January 2021 to December 2021. All included patients had been diagnosed as having irreversible bulbitis according to the AAE, so root canal treatment had been indicated. However, if after accessing the bulb chamber the bleeding had been controlled in less than 5 minutes, elective full bulbotomy had been performed. 56 patients between 11 and 76 years old were diagnosed with irreversible bulbitis, whose clinical history included data on the characteristic of the pain, and the intraoral examination that justified the diagnosis of irreversible bulbitis were included. The exclusion criteria were bulbotomy in immature teeth, bulbotomy carried out after bulb exposure during the removal of carious tissue, bulbotomy performed to treat a bulbal exposure of traumatic origin. The treatment record did not provide sufficient information on the clinical data supporting the diagnosis of irreversible bulbitis, or the medical record does not provide information about the outcome of the treatment over 24 months, and patient with systemic disease that could affect the outcome of treatment. And for the treatment protocol of the bulbotomy procedure, all database treatment had been carried out by the same operator, which had followed the same protocol in all cases, but using 2 different calcium silicate-based cement, either Biodentin or Endosequence Fast Set Putty from Brasler Company. And after bulb exposure, bulb vitality had been confirmed by the presence of bleeding bulb tissue and by the achievement of hemostasis by applying a cotton wool moistened with 5% sodium hypochlorite for 2 minutes with a dry cotton ball at the top. And in all cases included in the study, hemostasis has been achieved in less than 5 minutes. And for the data collection, in each medical history, the following data had been recovered: the name, age, sex, tooth type, characteristic of pain, probing bucket depth, tooth mobility, interpretation of the preoperative radiographs, tooth surfaces affected by caries, depth of caries lesion, and preoperative BAI score. And bulbitis diagnosed according to American Association of Endodontics classification, which in all cases was irreversible bulbitis. And with the data from the clinical history, each case was classified as mild, moderate, or severe bulbitis according to the classification suggested by Walters. And then the clinical criteria used to assess the outcome of the treatment were either no history of spontaneous pain or discomfort except for the first weeks after treatment, no swelling, no tenderness to palpation or percussion, and the tooth is functional, normal mobility and probing bucket depth, soft tissue around the tooth are normal and with no swelling or sinus stripe. Moving to the results in regard of the sample characteristics, 56 bulbotomy cases were found that seemed to meet the inclusion criteria. However, after carefully reviewing the medical records, 13 cases were excluded for not meeting the inclusion criteria, and there remained 43 bulbotomy cases were included in the study and analyzed. And the summary outcomes during the follow-up period, 4 of the cases failed before 24 months and required root canal treatment. The first failed case had been diagnosed as moderate bulbitis, showing spontaneous pain after 2 weeks, and being diagnosed as severe bulbitis and emerging apical periodontitis. So root canal treatment was indicated, and the next 3 failures occurred in teeth that had been diagnosed as moderate bulbitis, and all of them showing intense spontaneous pain and being diagnosed as severe bulbitis. And in one of those cases, the restoration was leaking. As for the outcome, of the 43 cases with irreversible bulbitis treated with full bulbotomy, the success rate was found to be 90.7%, and when relating outcome to preoperative diagnosis, according to the criteria of Walters, it revealed that teeth with mild bulbitis were 100% successful, 88.5% in moderate bulbitis cases, and in severe bulbitis, 80% were successful at 2 years. And there were no significant difference between the success rate of mild and moderate bulbitis, moderate and severe bulbitis, or mild and severe bulbitis at 2 years follow-up. And also neither the type of preoperative pain nor the affected tooth surface nor its depth significantly influenced the treatment results. And regarding intraoperative factors, the type of calcium silicate-based cement used was associated to the success rate. In the treatments performed with endosequence, there were 4 failures, while in those performed with biodentin, there were no failures. And a significant association was found between the presence of postoperative pain and the treatment outcome. Cases in which the patient had postoperative pain, which was 14%, showed a significantly lower success rate than cases in which there was no postoperative pain. And also the presence of postoperative pain showed a sensitivity of 50% and a specificity of 89.7%. So to conclude the findings of this study, elective full bulbotomy using calcium silicate-based cement was a successful choice for the treatment of mature permanent teeth with carious lesion originating symptoms indicative of irreversible bulbitis. It is simpler, less invasive, and cheaper than root canal treatment, and postoperative pain could be considered a risk marker for failure of full bulbotomy. The present results, together with large amount of scientific evidence accumulated in the past recent years, demonstrating that the erroneously called irreversible bulbitis can be treated by maintaining totally or partially bulb vitality. It highlights the need to definitively discard the conventional terminology of irreversible bulbitis or maintain it, but modifying its meaning towards the need to access the bulb channel.